this is our illumination series that Complia Health has brought into the market. So I appreciate everybody's time. My name is Casey Shirk. I'm the Chief Client Officer. I would expect that I've met most folks, but this webinar as part of our series is brought to the entire market. So we have existing clients of both our Suncoast and ContinuLink solutions. We have providers across service lines, including home care, hospice, palliative, home health. We are spanning coast to coast with this webinar. So if I have not had the pleasure of meeting you or introducing myself, I come to Complia Health with just over 15 years of background in healthcare IT. A large part of that was focused in the hospital settings. I have managed client success, client organizations at companies in the U.S. and in the United Kingdom. I had the pleasure of working closely with the NHS for a couple of years. And I'd say the benefit to everybody on this webinar is that I'm not leading it, and you will only hear from me for another 10 to 15 seconds. I do want to introduce Paul Menton as I turn it over to him, and Paul will introduce Kristen as he turns it over to her as well. But first, I'd like to introduce my colleague and friend, Paul Menton. Paul joins Complia Health. I won't get into his age, but he is older and more experienced than me. He has his background. We have the distinguished of having him on our senior executive team, as he has led the entire product strategy and all teams associated with it at companies that have annual revenues in the $4 billion range. He came to Complia Health really to drive the forward vision of bringing the products into market that's going to allow us to go deliver that vision and strategy as a company. It's an aggressive strategy. It's an aggressive stance of the company to go drive automation, to go drive efficiencies, and go drive new technologies into both the agency, the providers, the care teams, and very important, the consumer and the person. So without going too much into the new technologies, because that's what this webinar is all about, we've been talking about Emma, our electronic medical management assistant, now for a couple of months. And I'm really proud to turn it over as we are now showing it work within our solutions and live demonstrations. So Paul, thank you for hosting, and I'll turn it over to you.
Well, how could you not feel good about that introduction, Casey? I was just kind of thinking, who is he talking about? I mean, no, but I definitely appreciate it. Definitely appreciate everybody's time on this call. It's everybody's busy, so we are going to make sure that you get something out of this and understand what we're trying to bring to the market and the problems that we're trying to solve with it. I'm going to introduce Kristen now, but Kristen will be providing a live demo part of our presentation. So we do have some excitement in store for you. But Kristen she leads our product management team over our ContinuLink product line that serves our home health, personal, private duty nursing, personal care services, and so forth. So very excited to have her join in on doing this demo. But she's been in the industry quite some time. She is, I look at her as the ultimate success story. I used to say to people, I started washing dishes and now I'm, in the role that I am. But Kristen is definitely a very important success story for us, and she has brought a lot of experience to our product team. So very excited to have Kristen joining us as well. So without that without further ado, let's kind of go through the agenda. First I want to, again, it's a very action-packed agenda, very exciting stuff that we're going to talk about today. But this is going to be a presentation like probably you haven't seen in a long time. It's going to be something that I ask you guys to participate in, to engage in. There's opportunities. Hopefully everybody's got a smartphone device with them. Because there's an opportunity to give some instant feedback, number one, but also participate live in viewing what Emma can do, in real life, in real action. And so we're excited to be able to do that. I'll address some of the pain points and why Emma was important to address those pain points. Again, I talked about the live demo, and we'll go through some of the main features and benefits of Emma. And then again, at the end, all that interactiveness that you guys are participating in, we'll see a live feedback session from that. There's an opportunity in this to also provide feedback in one of those surveys that we're doing. So you can, tell us what you think, not only of what we've presented, but also where you think we could go next with this capability. And so let's dive in. So why Emma? What problems are we trying to solve with Emma? At the heart of it, we've been talking, I know that Casey said a few months. I felt like it's been a little bit longer because we've been talking about it for a while and in development, and that's really important. But Emma, at the heart of what Emma is a chatbot infused, AI infused solution that we've embedded into both of our products, both ContinuLink and Suncoast. And it's important because it brings some key functionality to solve very pressing problems that are out there today. We know that from everything out there that there's two main things that are driving people crazy, making them stay up at night late night thinking about how to solve these issues. And that's around caregiver shortage and caregiver retention. Some recent surveys and polls that are out there, one from the Labor Statistic Board showed that by 2030 for home health aides, over 200,000 home health aides shortage by 2030. You guys are feeling it today. And one reminder, when I talk about caregiver, I'm doing it really in a generic sense. This speaks to our nurses, our therapists, our home health aides, anybody that is providing some sort of healthcare in the home, right? So I'm talking about a little bit generically here. The other thing that's important to note on the skilled side, on our nursing side, is that over 20% of skilled needs are going unfilled. That has a revenue impact to your agencies. You guys see that all the time, but also it has an impact on obviously the clients, the patients, and their families. And if we're not getting the care, if they're not getting the care they need, that's not a good situation to be in. And I can think specifically around pediatric care, for example. We see now that hospital rates, hospital stays for pediatric with special needs or special medical situations are actually starting to go higher now because they do not have the qualified staff needed in the home to take care of that pediatric need. So again, we know that care in the home is best. We see better patient outcomes because of that. And if we are unable to fill that need, then it has a really bad impact on the, on patients, obviously. And then with caregiver retention, there was a recent survey out by Home Care Pulse that said that there's 10 top reasons why caregivers move and leave agencies. And I think Emma will address the top two very nicely. And those are the lack of communication, and that's proactive communication between the caregivers and the agencies, and also scheduling issues, and specifically the ability for our caregivers to proactively provide their availability and get matched appropriately and dependably. And those are some of the top two reasons why caregivers, we see retention, where it's at today. And so again, we feel like Emma is going to be able to address these head on. And so I want to introduce you to Emma. And Emma, as displayed earlier or talked about earlier, is a digital assistant. It's an electronic medical management system. But we really want you to think of Emma as somebody that's working for your agency 24/7. Always there, always present, and providing automation that today is very important to be efficient and to drive clinician, caregiver, and patient satisfaction. We'll specifically talk about some use cases that we've developed for Emma in our discussions today. Some of that is around caregiver coordination, client and family engagement, credentialing, alerts, and physician signatures. These are some of the top 4 things that keep people up at night when it comes to automation within the agencies. I know there's more, and we're excited to be able to pick your brains a little bit at the end to find out where else do you think Emma may be available to help improve some of these situations as well. So when we talk about automated caregiver coordination, we're really talking about scheduling. And we know that scheduling is such an important piece of the overall operation of your agencies. It's really interesting because it wasn't too long ago that I was out visiting one of our clients, and I had the opportunity to see a process take place in front of me that I thought really we could do better with. And it happened to be that it was probably 23 hours before the shift was to start, but a caregiver called out. They called out, and it happens all the time, and you'll see some of the numbers here on the right-hand side. But this caregiver called out and said they couldn't make their shift, and then the mad dash was on. And you guys know what I'm talking about. And it consisted of course, using, they were using ContinuLink, this agency, and so they were able to do caregiver matching. They were able to find the appropriate caregivers that had, weren't in overtime, that matched the credentialing needs. So all that stuff happened, but there's still a process in place. But with all that, getting on the phone, calling the different, potentially the different caregivers, as well as coordinating with the patient or the patient's family. And so what happened here is we had 2 schedulers. One was calling the caregivers, one was calling the patient, and trying to match up and, fill that shift. And while at the end of it, it was about a 45-minute process, everybody was excited and it was great, right? The shift was filled, client got their needs met, agency was able to preserve revenue, caregiver was able to get paid, all those good things happen. But I thought to myself, there's got to be a better way, right? We have to be able to automate this. And understanding technology and specifically the chatbot capabilities, to me, that led to, what we're going to see today. Marrying up those 2, that technology with that practical need, set us up nicely to provide Emma to the market today. And, the cost of these missed visits, they're huge. These are actual numbers amongst all of our clients that we were able to look at. But 11% of shifts that are canceled due to the last minute call outs, 23 hours and less. And that usually causes a scramble. And again, 11% of the time they're not getting filled. This cost a mid-size agency about $700K per year in unfilled shifts. And obviously there's a human side of that, right? The patients aren't getting their needs taken care of, and that has negative outcomes. We feel that Emma is going to be able to potentially reduce this by at least 40%, saving that average agency almost $300K annually. So you talk about ROI, I think that's built into this. And it's, as you see the demo, it becomes self-evident. So what Emma is going to do in this scenario is going to be able to communicate these open shifts to qualified care providers. They're going to be able to confirm, she'll be able to confirm acceptance. And then within the EMR, within ContinuLink, also coming to Suncoast, we'll be able to make those schedule changes all without human intervention. The entire process can be automated. And then in a minute, Kristen is going to show you that process live within within ContinuLink, and we expect that feature capability out by the end of July. And so we're excited to show that. And I guess without further ado, I'm going to go ahead and turn it over to you, Kristen. I want to call her KW. I'm trying to be proper on this call, so I'm struggling with that. But Kristen, over to you.
Perfect. and thank you so much for the lovely introduction earlier. I appreciate it. So I am Kristen Weiner, and I'm going to be showing you guys live Emma for our caregiver matching and shift blast. So with our schedule, when you have that open need and you need to find caregivers that are going to match the criteria and then get that notification out to them, you're able to do that right from our calendar, where you can go to the client's schedule, find that shift that you need to fill, do a simple search based off of the matching criteria that you need to filter for, and it will return the matching results. So these are going to be caregivers that match the criteria for that shift. You can then select to send it via a text message, which is what I'm going to be showing you today, or Emma, which is built into our outside portals for Clinical Edge and Mobile Edge. So if I select that text enabled, I just simply click my send notifications, and I'm going to have it required that I have to approve the claim shift. So if all three of these people end up saying they want this open shift, I get to actually pick which one I want. Now, looking at this, Jude Krause is going to be paid $17, so I might not want to go with her, but we will be able to choose that under our homepage. So I send that notification out. My screen updates let me know that it was sent successfully. And just to show you guys how you can track this communication from the actual back office, we have the My Homepage. This is going to show that shift offer that I just sent. So I would be able to come in here. I can see these shift offers, and I'm going to just go ahead. I talk faster than it moved, so I'm going to go ahead and open it up. And we have this one right here. I can open it. I can see that it went to all three. Currently, responses are pending. I'm going to show you live. You can see up here. I'm going to show you live responding to one of these. But if you wanted to view a chat, you can also click on it. And our little Emma pops up with the conversation so that you can view that right from here. Just to show you what it looks like on that caregiver's phone, I get my text message, and when I open the text message, it gives me a link to open up the conversation. Within that conversation, and you guys should be able to see this larger on your screen, it'll tell me that there is an open shift for an HHA hourly service. It gives me the first line of the address, the date, and the time. I can then accept, decline, or propose a new time. I will show you guys what the proposed new time looks like as well, but on this version, we're going to go ahead and accept. And I'm going to take it back to ContinuLink. So it lets me know that they've received the response. I'm going to go right back into ContinuLink and go into my conversations. Here's that conversation that we lifted. Here is an accept. I have not responded from Jude Krause, and Kristen Krause has proposed a new time. So I can actually click on all of these. I can view the conversation, and I can choose which one I want to accept. So again, if you have different rates for the caregivers, if you have different times that may or may not work with the client, that is all cut out and automated through this shift blast to the caregiver. So with just a simple accepting of which one I want to choose, I can accept that. It will update the conversation. You'll notice that that closed my conversation. If I go right back to that scheduled calendar, this shift is now scheduled and it has the updated proposed time on it. So I did all of that in about a minute, maybe 2 minutes, and I already have it staffed. So this really does cut down on having to call each of the caregivers and having to discuss different times back and forth, and then communicating back once it's actually been closed. If I go back to the shift offer, you will now see that this has been an assigned shift and it was assigned to someone else. So it updates that conversation for all caregivers that the notification was sent to.
So
and that's how fast it works.
So very important, a closed loop communication plan there, right? Without anybody having to pick up the phone and make those calls. Now, we're not saying you can't. People like to talk to people, but we know that caregivers, from surveys, the number one way they want to be engaged is through text messaging and smart applications like this. And I think that that's important. So Kristen, appreciate you showing us that. And we do have some more engagement opportunities for our, you know, our attendees today here coming up in a minute. So I'm going to reshare my screen. And again, she showed our what we call our automated caregiver coordination. This is being able to blast out all the open shifts based on, you know, the attributes that you need in patient matching. And then the caregiver to receive this via a regular SMS text message. So there's no app for them to install. I think that's very important. It's appless technology. They responded back. They could have changed the time and proposed different times, and all that communication happening in real time. So with that, what I'd love our attendees to do, if you will, if you'll take your cell phones, your smartphones, and hold it up to the screen and do a 1-question survey by scanning this QR code, we'd appreciate it. I'll wait about 30 seconds. I'll play the Jeopardy music in the background. Dun, 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 dun. Just kidding. But it's just a quick survey, and at the end, we'll show the live results. Perfect. All right, so moving on to our next really use case for Emma is, you know, you saw the shift blast interacting with the caregivers in a very exciting way, new way. But now what I want to do is kind of close that loop. So it's not often that, you know, when you have to change that time, you got to get back on a call and call that the patient or the family member. And also we're able to automate that process through this engagement. And so, you know, why is this engagement important? Well, there's a few statistics out there that are really prescient. We know that today, in a recent survey, over 57 million family members are working as unpaid caregivers. So they are involved in their care never before. And them being engaged with the scheduling changes and caregivers coming to their home is very important. We also know that engaged families and patients have better health outcomes. This has been established recently through a CMS study that was released by the National Institute of Health in conjunction with CMS. But it's anecdotal, right? We've known this. If you engage and you are and have them, you know, contribute to their care, you're going to get better patient outcomes, better health outcomes. And so that's why engagement is important. And then also increased communication with families, we've seen in surveys from the Healthcare Pulse, leads to higher client satisfaction and also leads to more referrals. So all good reasons why engagement's important. And with Emma, we're able to engage in a way that is automated and does not strain our, you know, our schedulers and administrators at our agencies. So this engagement is a direct engage with the clients to confirm the care needs. So you saw that first part where we're engaging the caregiver. Now this follows up and engages the, you know, the patient or the family member. And if you would, this is another opportunity to be interactive. So if you'll take your phones and scan the QR code on the screen, this will actually walk you through that live Emma interaction and engagement. So I'll hold just a minute while you do that. All right. So I think hopefully that gave you a sense of what it was doing, what Emma was doing. You know, that basically it was trying to advise the family members and patients about schedule changes and update visit schedules. Also provide information about the care providers. As you know, they do have a right to decide whether or not who's coming to take care of them, who's coming to their home. So that's a very important piece of it. And this just ensures alignment across the agencies, the caregivers, and you know, our clients. And so again, a very automated process where nobody's getting on the phones, have to make these calls, and we're engaging them how they want to be engaged. I think your hands are going to get tired by the end of this, but bear with me. So if you would, take this real-time survey on this particular use case around client, patient, and family engagement, we'd appreciate it. Again, scanning the QR code, and it would be a simple question. All right. I imagine there's probably 50, 60, 70 right now taking this survey, so I'm excited. All right, so the next use case that we've developed within both of our products is our credentialing alerts. We know that this is a very manual process today, and anytime that a caregiver shows up at a house, there is some regulations and rules that guide that, right? There's education that has to happen. There is licensure that has to be made sure that's maintained and up to date. And today, in a lot of systems, it's manual. I mean, we maintain and provide alerts today in our systems around attributes and expiring attributes. But again, we know that there's more that can be done from an automation process to make it smarter. And so why would we want to automate this process? Again, I said it was time consuming. I think you guys have better things to do than manage all these credentials all the time. We also know that if sometimes these credentials expire and they slip between the cracks, and what happens is that you cannot go see that patient, that you can't visit that patient. And so we have a very bad situation where a visit will get canceled because we can't fill it, because we have a credential that expired and it's really last minute. And we see that that has an impact on our agencies, and conservatively over $50,000 a year is lost annually because of that. And it also leads to caregiver dissatisfaction because, hey, maybe they weren't alerted to the fact that their license was expired. They would have liked to have proactive notices. Obviously, it affects, our client satisfaction as well when it comes to making sure we meet those shifts. And so what Emma is able to do in this situation, she's able to send out proactively these notifications about expiring credentials or education material that needs to be updated. And she can provide she can also accept that interaction. So what you'll see here in this example of Emma is, if you guys want to scan this QR code, this is an example of a CPR card that's expiring. And Emma is then able to send out that alert proactively. And you can engage with Emma by uploading your CPR card. And what will happen with that CPR date, it gets updated in the system. And now, again, the loop is closed and the certification has been validated and is up to date. Once again, without having to, a manual process to cover this. So if you think of the applicability of this, as I mentioned, educational material, mandatory in-services. We also see this applicable to onboarding in general. Again, being able to easily onboard caregivers drives satisfaction and drives retention and recruitment. All right, hopefully you guys have had a chance to look at that. Now, I mean, it does ask you to scan something in, so don't make it personal. But we dump this information at the end of the night on our demo server, so no worry there. Okay. And then, of course, following the last presentation, if you guys would scan this QR code to answer a one-question survey on your thoughts on this capability. All right. So another use case that we think is very practical, and this really, it was interesting because when we went to our client advisory board, we had talked about some of the potential use cases for Emma and the automated chatbot solution. And for our hospice and palliative care services, this is one of the things that came to the forefront, and this is the ability to obtain physician signatures
Oh, no, that's okay. I'll look and see.
quickly and efficiently. And, you know, we also see obviously application within ContinuLink because we know that there's regulatory compliance that goes along with this. If an order is not signed, we're not dropping the bill. And so today there's a number of ways that these signatures get done. It's still, you know, the number one way is with the fax machine. It's been around since the 1800s. It's kind of like people's student loans, although there is forgiveness coming, I hear, so that's good news. But these this fax machine has been around forever, and people continue to use the fax machine, but we know that there's better ways. And I actually had an agency not too long ago say, listen, this is very tough situation for them, especially during COVID, but to get some of the physicians to follow up and sign these orders, these certifications, recertifications, they were sending people to their offices and waiting on the physicians to sign these orders. And it wasn't a really, it wasn't a fun process for the people going out to do this. So very difficult to follow up. And, obviously this is not, it's been going on for a while, we get it, but we know that with technology and Emma, there's a better way to solve this problem. And so what you'll see here in the QR code, it will walk you through, if you'll scan that, it will walk you through a Emma presenting a set of orders to you and providing you the ability to sign those orders in real time. And again, this will speed up that process. It will, it will take care of that follow-up expense. And it does lead to physician satisfaction because it's a very easy process to engage with. You'll see this done through the through text messaging, but we also have an option that we're delivering through security email as well. So it's however the physicians want to be engaged to capture that signature. And so I think give you guys a minute to walk through this process.
And while everybody's doing it, Cindy, I see you've got a virtual hand raised. As soon as we go through the questions on the physician signature, I'll come back and just make sure that we get your question asked.
So if you've had a chance to experience this, one of the things is, we know that physicians can get bogged down with a lot of orders coming from different agencies. One of the things that we've provided for is the ability to batch these orders so that they can come at them at a pre-designed time, and for the physicians to then go through the process of checking those off that they've signed them. And I think that's really key to winning that engagement with our physicians. All right, and just like the other use cases, we'd love you to go ahead and take a real-time survey question on this. You'll see 2 questions on this survey. One of them is your thoughts, obviously, about this functionality, applicability to your agency. But then the second question is an opportunity to, where else would you think this type of automation and chatbot functionality could be used in your agencies? So I'll wait there just a few minutes for you to be able to answer that question, and then we will show the results in real time and discuss, answer any questions as well. Casey, I'll let you be the official. I think that's enough time, keeper.
I think you got it. let's give everybody just another second or so, and we can do the survey discussion. If you need more time, you could raise your virtual hand if you want. I think we'll give everybody another 10 or 15 seconds, Paul.
Certainly. Just the last comment. I think Casey mentioned physician signature. This capability, this automation is coming first to our Suncoast solution out at the end of July, and then will be followed up in our ContinuLink solution as well. Casey, I think that'll do it. So I can maybe move to the live response. Sound
Yes,
about right?
go for it.
All right. Give me a second. I will bring up the live responses.
Hopefully someone's feedback was suggestions on how to get all physician signatures all at the same time and have a complete strategy there. It's an ongoing conversation with all of our clients and new agencies.
So this was the first question about Emma and the shift blast capability, caregiver automation. We had, I think we had a lot of people saying, yes, this is absolutely something that they would use. So the overall weighted average was 6.8 out of 10. So I think this is very, very exciting, right? As far as what you guys feel that this would be useful for. We had 20 people respond to this. So that was the first one. Let me go ahead and go to question number 2. And this was the Emma client, patient, and family response, the family engagement. Again, we had 17 responses, and it was 7.76 out of 10 was thought it would be valuable to be used in your organization, as you can see here. All right. And then for question number 3, this is live results, so it's great to be able to see that. So this is Credential Alert. How can you see Emma helping you in credentialing? And we had, again, 17 responses, and I think it's very positive, where we see a combined average of 7.65 out of 10. So almost 8 out of 10 feel that this would absolutely be beneficial in their agency. Okay. And then moving on to the next question. This is where we asked 2 questions. One, Emma physician signature, and any other areas or workflows to process or processes Emma could be a good fit for. So in the area of Emma for physician signatures, 12 responses, and we, again, very positive, 7.75 out of 10 weighted average. So I think we're on track, which is exciting. Make sure that we're hitting the market where we need to. And then we have, let's see, and we're going to show all the responses, any other workflows or processes Emma could be a good fit for. So hopefully you guys can see that, but training functionality questions, that's interesting. I agree. Daily pain and symptom text, yep. Weekly family satisfaction check-in. Yep, we have thought about that. We agree that that's a good engagement process. medication reminder and refill prompter. Absolutely agree with that as well. Paperwork and education of family makes sense. Cannot think of anything right now. Got it. And then real performance and not sure. So I think we've got some good suggestions there for sure on other use cases for Emma. So I think maybe we had a question earlier, Casey. Maybe you want to field that question.
Yeah, we did. Cindy, do you want to go off of mute if you'd like to share your question? Or you had your hand raised?
Yeah, sure. On the credentialing expiration, does it have the ability to send out the text message, 30 days before it expires? Because once it expires, it blocks them from being scheduled.
Right. Yeah, that's the plan, right? So there's not only will it be able to send out in advance and keep sending it out on a schedule, but also if there's a time where you say, look, if I haven't had a response 15 days out, 14 days out, then escalate that to a scheduler or a credentialer automatically within the workflow. So it has the ability to, escalate as well.
Great, thank you.
Sure. Other questions?
Paul, I think there's a question from the group. The question is related to Suncoast, but I think it's related to both applications, Suncoast or ContinuLink. What type of implementation, what's the rollout of Emma look like from a timeline perspective?
It's pretty fast. KW, I can let you comment on that. There's there's some verbiage and things like that we want to work on, but it is a cloud-based solution, so there's no quote hardware setup or anything like that. But KW, your thoughts on that?
Correct. Yeah. With ContinuLink and rolling out Emma, it's really just a quick configuration and then training the caregivers or sending out a notification to them that this would be enabled and be used. So it's actually fairly quick implementation. I would say within a week, 2 weeks.
And on the Suncoast side, we feel like it's about the same time frame, right? Very easy to set up and implement. There's also a process for notifying the physicians that we do that automated as well, that offer this ability for them to subscribe. And so that is part of that setup for Suncoast on the physician orders. Will be the same for ContinuLink as well. I think that's all the questions that are in the chat room at this point.
I think so. I want to comment here for just a second, because the questions about the implementation, I hope both Kristen and Paul helped. A big part of the implementation of Emma and the rollout is working with the agency directly on the training and making sure that the end users are prepared and understand that new workflow of receiving automated messaging and the responses. So part of rolling out Emma, can very well be, governance at the agency level. How will your teams expect to interact with that? And again, work on the responses and the rollout for that. I only have initials for the user, but GS, did that cover your questions? I want to make sure if you want to go off of mute and ask if we didn't cover it in full your question. Okay. All right, perfect. The other piece about Emma that I hope is a strong takeaway for both our clients and then also agencies that are considering coming on board with our home health, home care, or hospice and palliative solutions is the strategy itself. And so, as Paul alluded to at the front end of this, when we looked at holistically, where did we feel we could drive the most value and change and efficiency for our clients? It was this technology framework that allows automation and tries to give time back to staff members, both in the back office. Hopefully you saw that with Kristen's live demo of you saw her basically being able to confirm that shift fulfillment in a matter of a minute and a half, as opposed to whatever your workflows are today in your agency. And on the front end, the front end staff, clearly our goal as a company is to try to drive differentiation for our clients of how do they interact, how do they enable their care team members, their team members to manage their days and be more efficient with their time as well. Paul, I don't want to put you on the spot, but I'll ask the question anyway. Part of how we deployed Emma and the chatbot, the chatbot framework is, could you talk a little bit about the framework and how the capabilities are to expand into additional capabilities and kind of that process and logic from a strategy perspective?
Yep. Appreciate the question. You didn't put me on the spot, but it is the framework is the reason why the framework is important is because it allows us to quickly develop and release additional capabilities and functionalities for Emma to automate different processes. You guys shared a few thoughts of where you could see Emma working. We also think we can have it working on the revenue cycle side, where proactively and predictively providing input as you are working through the revenue cycle. And I think that there's a lot of applications for Emma, but the framework was developed in such a way that it makes it quick to roll that out. We eventually will be releasing over time the ability to build some of your own chatbots as a service, or have us build those chatbots for you as a service. And it's a very user-friendly way of doing it. And so it was important for us to put that strategy in place to be able to do that, to iterate quickly and release automation that really, I think, has an opportunity of changing how we operate today, both the back office, clinically and financially.
Perfect. And, for everybody on the call, part of this rollout strategy, you heard, for our home health, home care, private duty, our ContinuLink clients, we're rolling out that shift blast immediately because we prioritize that as the greatest need or want from that user group. For our hospice and palliative, almost across the board, that physician signature was viewed as a workflow that they'd like to have automated first. And so part of what we were looking to do for this webinar, part of the reason why the survey was important was, to get real-time feedback from as broad of a group as we could. And so really appreciate that feedback from everyone. As part of the Illumination webinar series that we're committed to continue, we'd like to make available a good mix of market, healthcare post-acute updates, updates from Complia Health related to product or other things. And so the last bullet for the webinar in July, I'm coordinating with our partners for a market update. I believe we're going to target the hospice and palliative regulatory updates across the United States. Bill Dombey was our presenter last month. If you missed that one, We do have a recording, but we're going to work with his team members, work on an agenda, the presentation, and get that out for everybody that would see that as value next month. Another topic that I think is important that I'd like to fold into these webinars, it's become evident to our team as we attend conferences across the U.S. that not every agency has the ability to do it. So since March, in March, we attended the NHPCO Leadership and Advocacy Conference. In April, we also went to the Palliative Care Conference. And then just last month, we attended the Value Conference in Chicago. Why this is kind of top of mind is next month we'll be going to the Financial Management Conference in Las Vegas. And you know what I'd like to do is come up with a good format of sharing information, topics that we have seen, speakers that we attended, and just make sure that we can kind of share across all agencies our takeaways from those conferences as we continue to attend in those. I'll take a break here. Simply, I don't want to go till the top of the hour just because that's what the invite is, but I'll pause and if there's any questions or wrap-ups for anybody on the webinar, I'd like to give you the opportunity to go off of mute and ask any question. And Susan, as I just pause here, I'm looking at the comments. Susan asked if this was if Emma was a product that would be paid extra for. Emma is a new solution, and we'll work out the scoping and pricing. The answer is it would be an addendum to an existing agreement. For new clients coming in, I think everyone is hearing from your client executive team, from your sales executive. You know, we're building Emma into this is our standard. But certainly as we continue to add on new products for our client base, we want to give you the opportunity to contract for those as well. Any additional questions? Perfect. I appreciate everyone's time. Paul, even though you know, doing presentations isn't your full-time job, and Kristen, same with you, as a you know, leader within our solution organization, our product organization. I appreciate both of you kind of giving an overview of the strategy, the approach, and what we're making live to our clients next month, rolling out in production. So thank you very much. Your client success executives and your client executives will follow up with any attendees, just making sure that we do have all answers and questions and follow-ups that are needed from the webinar. I appreciate everybody's time, and hopefully you found the time valuable as well. Thank you so much.
Yep, thank you.
All right, bye-bye.